Diabetes mellitus, or what many people will call sugar diabetes, that it's commonly known as. A lot of us think about, oh, it's just my sugar that's too high, or I've got sugar. But really, it's a disease where there's the carbohydrates that we've talked about. It's an abnormal handling in the body that produces the elevated blood sugars. Diabetes is also, it's due to either complete or some deficiency of insulin in the body. We define blood sugars. If you're fasting, blood sugar is over 126 on a couple of occasions. If we just come in with a random blood sugar and you're over 200, and are of over a 2-hour blood sugar over 200. What diabetes develops from is your body lacks insulin or has an inability to use it effectively. Your pancreas sits in the right upper quadrant of your stomach, and the pancreas cannot produce enough insulin, and if it's a relative lack of it, that's called the type 1 diabetes. As we go into the type 2 diabetes, the body, it's getting more into where your cells cannot use the insulin effectively, and it's not getting into the cells, muscle and the fat cells. The symptoms of diabetes, many times people don't have any. But other times, they're finding, and it's caught on a routine screening in the doctor's office as we check blood sugars and screen you at a screening. But many times as that sugar builds up in the blood, it's not getting into the cells because the cells are resistant to it. Then what we can get is some of this, and it affects. We'll get some blurry vision. We can have the increased thirst. We're drinking more and more. I had the occasion to talk with a gentleman a little bit before. His blood sugar was like 1,400, and when we're talking at 126, again, I says, how'd you feel like that? He says, I just couldn't get enough juice or enough water in me, but I was drinking all this juice and all this water, and then I was having to pee all the time, and he said, I just thought I had the flu, but that's how it comes. Feeling tired or ill. Sometimes if we have skin or gum infections, or bladder infections, they just keep coming back all the time, sores that don't heal and things, we start looking at what's causing it and stuff. Coming into that also, very frequently, women can develop repeated vaginal yeast infections. And so why is this happening? Sometimes it's, that extra sugar feeding the body. Sometimes dry, itchy skin. Again, these are not conclusive with everybody. You can have unexpected weight loss. A patient said, oh, it's pretty nice. I lost 40 pounds over the next month. Well, have you been dieting? No. Well, it was dropping it kind of fast. And why do you lose the weight? Because you aren't getting the sugar to build in your cells to help it build up. The cuts, and then sometimes loss of tingling or burning in the feet can be some. That's usually a later sign that can develop. What are the complications that we're trying so hard to develop and stuff? They did a big study through the United Kingdom a number of years ago. It was called a UK PDS study. For those of you, if you want more information, we can share it. But suffice it to say that those people with diabetes, we know that with the uncontrolled, you have a 25-time risk of developing retinopathy or bleeding behind the eye. You have a 2 to 6 time risk of stroke, 2 to 4 time risk of heart disease, foot and leg amputations about 5 times, and renal disease. And so thankful again to have a great nephrologist on staff to help us with this, and we watch that close, is looking for this and stuff. And it is so important to keep follow-ups to make sure that these things don't happen, because they don't have to. The treatment of diabetes is centering on management. It's meal planning. I don't know if many of you had a chance to hear Colette this morning. Again, she's had a talk. Education on how to deal with it when I'm sick, what medications, how do I take it, what are my blood sugars, activity, medication, be it insulin, be it medication, and monitoring glycemic control. And again, with the monitors, the meters and stuff that are out now, it I know it's not fun to poke your finger several times a day or whatever, but people that come on to say to me, or come in and say, Steve, can you do something with my blood sugars, or they're running high? How do you know they're running high? Well, I can just feel it. Well, you know, we need to see where your blood sugars are so we know, tweak this insulin a little, this medication a lot. And it's so nice, I mean, you can keep track of it yourself by running, hey, I'm always high in the morning, but I'm low at night. Well, maybe you don't need as much insulin or whatever, but I'm trying to say is you can bring the sugars into us and the trended, or we've developed a call line for diabetes right now where you can call it in. You bring in your meters or your pump, we download it, and I like to share it a lot with patients, and it just kind of, you know, shows where that trend of the blood sugars are going, and it's just so important.